Hi everyone, this is Dr. Erdoğan by Smile Hair Clinic. Today we would like to talk about one of our patients who has in 2022 had a transplantation with us. He's from France, he's 54 years old, he had a 4,250 grafts. We would like to talk about his progress, his before and after condition as a case study. So let's dive into it. Okay, the patient is, most of the male patients we have androgenetical alopecia background, and 90% of all results, all problems that is occurring like this is because of the DHT problems or other male pattern baldness triggered things. As you see, his hairline is receded back, the recessions in the bald part. Also, he has some hairs here, but already to the crown area, until the crown area, he has so many low density areas. This is how it looked like from the top. As you see, he has still some hairs, but in the crown area, we see some lower density appearance. Maybe even these hairs are covering his entire crown area, but still he needs some more density there. So what we did a consultation with him, and we always talk this with the patients to decide about any hairline that they are requesting and we are recommending. So this is the point that we agreed with the patient. Sometimes patients want to lower more about their lines, and we always want to take as higher as we possible, because we know that in the main hair transplantation principle, if you squeeze narrow and make the small area, we can have the more density. Okay, so his donor area is, you can't see it from the TVs, but as you see, he has some donor area here. It is not very dense, it's not very thick maybe. His crown area, sometimes, with most of the patients, if the crown area start receding, sometimes it goes to the mid-scalp, it merges with there, and sometimes that crown area goes till donor area and it affects the donor area. At that time we can't get too many grafting from the donor area. I know we know something, we have a safe donor area, which with most of the patients, if we just take those hairs, they are permanent, they are testosterone resistant, and we wanted to take, but those numbers are 1,500 to maybe 2,000 grafts, so we always want to make higher or lower to get more numbers to cover more areas actually. Okay, so this is the transplanted photo. As you see, density is not too high because we wanted to cover more areas actually, but still, even we don't increase a very high density with this patient, we couldn't reach the crown because it's a large area. Mostly the front is nearly 60 to 80 centimeters square. The mid scalp is usually 60 or 70, and in the crown we also see a 80. So if you sum up all the things and if you stay in the same density, you need thousands of grafts to cover this head, for example. 13,000 or 15,000 grafts to just cover the entire area in the same density that he has before. But our aim is not to catch that density. Our aim is to catch the optimum density, which can give a patient a good appearance. So that's how it appears after the 13 days. That's the most important part for the patients to return to their social life and their work life, and they are very curious about how they appear. At that time, this patient, most of the patients is on the international patients I'm talking about, when they return back to their home. Of course, they wanted to do a good washing style, but we don't allow them not to damage the graft, so they are very carefully tapping or patting on the hairs, and sometimes we see scabs like that. So after he remove his scabs after the 10th day, which we allow after the 10th day because it's more secure at that time, it looks much better. Other than that, it looks like he has a very short hair. Also this photo and the other photo looks like there is nothing appears as he has the transplantation. Now this is the 3rd month photo. We see some things that is starting with some patients. It starts at 3rd or 4th month, and it's a progressive thing which may continue up to the 12th month. So we see some hairs is growing better than he's comparing to the previous photos. His donor area already healed nicely, so it looks good in this month. We expect this appearance with the patient. Now I think he's changing, you see, it's a 6-month photo and already he changed a lot from his previous photos. We always wanted to share some different cases for each patient. We do not want to get the most incredible results for the patient, because we want from every age, like 30s, 40s, 50s, we would like to have similar or different appearance of the patients to who is watching us, because we know that, I mean, everyone is different and everyone can't get different results, but with this patient we wanted to achieve a nice result that is covering his entire head, giving a good hairline and also giving a different appearance. And according to the patient's feedbacks, we know that he's very happy even in this process. And this is the 12-month photos. Maybe he's more closer in this photo, so you can see the hairline it doesn't look like that he has a transplantation. It looks very good. Also, he's smiling. I think most of the patients in the end of the process, I think they are very happy, and we can understand from his face. Hairline is, as you see, it's good according to his age. It's not too low, it's not too high. Already he has a good style. His donor area is looking good. So we are very happy also that the patient is having a good success. So if you are just comparing the both photo, it has a big difference. Actually, after 40s and after 50s, we usually see even 10 years younger appearance with the patients. Maybe it's not very possible with 20s or 30s. You cannot be 10 years old, of course, from 20s, but in these patients, we usually see better result, and they have more self-esteem, they are more encouraged maybe, and they are more happy, and they are sharing with us. So hopefully you will get if you are in a similar condition, you should consult a doctor like us for the authority, which is mainly expert in the hair loss or hair surgery. If you still have some questions, please write us on the comments or just reach to us and we will give you a doctor analysis. Thanks so much for watching.